Hello people, how are you? Today we want to look at diuretics. That means dilute urine, correct? So there is more urine. What happens if there is more urine? You are going to lose water from your body, correct? You're going to lose water, sodium, all that from your body. Now why do you think we need diuretics? Why do you want to give a patient a diuretic so that he will have more urine? Yes, because if they lose water, they will have less water in the blood. So that will decrease the blood pressure and it will protect the CVS. So you can give it as a treatment for hypertension. So if a person has excess blood pressure, so you can reduce their blood volume by a diuretic. Okay, very good. So let us look at the diuretics classification. Mainly you have the loop diuretics, then you have the thiazide diuretics, then you have the weak diuretics like carbonic anhydrase inhibitors, then potassium sparing diuretics and osmotic diuretic. Is it clear guys what we have said so far, the classification? So basically as you can see in diuretics, the classification is like loop diuretics, thiazides, then you have the weak diuretics like carbonic anhydrase inhibitors, potassium sparing diuretics and osmotic diuretic. Okay, is it fine guys? Now let us look at the important examples here. Loop diuretics, you should know furosemide or furosemide because both these terms are used, furosemide and furosemide. So both you should know guys. So loop diuretics, furosemide, furosemide, both are same but both the names are used. Okay. So furosemide, furosemide, they will ask this in exam also, you should know. Okay. It is actually used as diuretic and also it is used in heart failure. Then moving on to thiazides. Thiazides they have asked in the exam. You should know like there are thiadiazines and thiazide-like substances. Like the true thiazides are like hydrochlorothiazide. These are benzothiadiazines. Oh God, so much to remember. Okay, don't worry. Just remember thiazide example is hydrochlorothiazide. Thiazide, hydrochlorothiazide. Okay. So these are used as diuretics. They are used as antihypertensive and heart failure medicines. Okay. Moving on guys. Weak adjunctive diuretics. Let us look at weak adjunctive diuretics. So these are weak diuretics. Carbonic anhydrase inhibitor like acetazolamide. Acetazolamide is a carbonic anhydrase inhibitor. It is used in treatment of glaucoma. Okay. Obviously it will reduce the intraocular pressure. Okay. Moving on to osmotic diuretic, let's finish, then we'll go down. Osmotic diuretics, you have mannitol, isosorbide and glycerol. Mannitol, isosorbide, glycerol, these are diuretics. Okay, how these actually work? They will make the urine or whatever you have, the filtrate from the glomerulus, it will be very hyperosmolar. So it will not let water be reabsorbed by our body. Okay, so we will lose the water. So you understood no now? Osmotic diuretics. Then coming to potassium sparing diuretics, you have aldosterone antagonists like spironolactone. What aldosterone actually does? Aldosterone allows sodium reabsorption. However, when you have antagonists like aldosterone, it will not allow sodium reabsorption. So sodium is lost by us and water also will follow sodium, right? So it will become a diuretic. So it is a diuretic and it is used in heart failure. Then you have amiloride. Amiloride is a very important diuretic. It will be a sodium channel inhibitor. Okay, it is a renal epithelial sodium channel inhibitor. Amiloride. Okay. What were the drugs you learned so far, guys? I learned loop diuretics, furosemide. Then I learned thiazide like hydrochlorothiazide. Then we have carbonic anhydrase inhibitors like acetazolamide. Then we have osmotic diuretics like mannitol, isosorbide, glycerol and potassium sparing diuretics like spironolactone and then amiloride. Very good, very good. In exam, what and all they have asked, let us see. Furosemide has been asked in the exam. Hydrochlorothiazide or thiazides itself complete has been asked in the exam. So you need to know the other example, benzthiazide. Okay, that shouldn't be difficult. Benzthiazide, and also you can remember thiazide like you have chlorthalidone. Chlorthalidone is thiazide like. Then coming to carbonic anhydrase inhibitors, you have example acetazolamide. This has been asked in the exam, acetazolamide. Then you have osmotic diuretic like mannitol, isosorbide, glycerol. These also have been asked in the exam. Potassium sparing diuretics, spironolactone, amiloride. These have been asked in the exam. Actually, amiloride they didn't ask, but potassium sparing they asked. Okay. So basically everything is important for the exam. Okay. All these have been asked more than 2 times, so you should know all of them. Okay. Mainly furosemide they have asked, mannitol they have asked. Okay. Mainly they have asked these. Furosemide, mannitol, potassium sparing. These 3 are very, very important. Okay. If you still want to focus, then focus on furosemide, mannitol and potassium sparing, that is spironolactone. Okay. Just let's look at what and all is available in the market. Furosemide, okay, or furosemide. Actually, am I telling it correctly? Furosemide or furosemide, correct. So both the names are used, so you should know them. Furosemide available as tablets, available as injection. Then for thiazide, you know hydrochlorothiazide. Then thiazide like you have chlorthalidone. All are tablets only except this furosemide which is available as IV also. Coming to the slow acting ones, you have acetazolamide. Then you have osmotic diuretic, that's mannitol. This is an injection again. Spironolactone tablets which are potassium sparing. Remember in the osmotic diuretics they are actually injection. Mannitol is injection. Okay. So everything tablets except mannitol which is injection has to be injection. However, furosemide can be given as injection also. Understood, right? Now let us quickly look exactly where what works. Loop diuretics like furosemide, it works on the ascending loop of Henle. Okay. So how it works normal first you see, don't see the pharmacology here. Normal job of kidney is to reabsorb. Okay, reabsorption. What we want, it will try to reabsorb. So it will try to reabsorb sodium. When it tries to reabsorb sodium, now our body, that time it will reabsorb water also. You understood, right? Our body is trying to preserve sodium and water. But then what will happen? We are retaining too much water. So now these drugs, what they want to do? They want to remove sodium. This is what is the final thing they want. More water out, more sodium out. If sodium goes out, water will anyways follow. Okay. So what will happen in loop diuretics? First of all, look at loop diuretics. What it will do? It will prevent the reabsorption of sodium. So sodium will end up coming here. Okay, in the urine it will come. So water will follow anyways. So it will prevent sodium absorption. All of these do one thing. Keep in your mind, what do all these diuretics do? They prevent sodium reabsorption by our body. Oh, good. They prevent sodium reabsorption. So they prevent water reabsorption by our body. What do diuretics do? They prevent the reabsorption of sodium. Hence, they prevent the reabsorption of water. Hence, they make urine more dilute. Sodium also goes with the urine. Very good, very good, very good. Okay, now let's move on to the next. The next after loop diuretics, we want to focus on thiazides. Thiazides, they work on the early distal convoluted tubule. They also do something similar. We'll come to that. But just look at the location of action. Thiazides is here. Then after thiazides, what will come? Weak diuretics. There you have carbonic anhydrase inhibitors. They work on the proximal convoluted tubule. Then after that, you have the osmotic diuretics. Osmotic diuretics, because they work everywhere. Basically, how they work, you know, they will be here, no, osmotic diuretics come here like mannitol. Like here they will be. That time what will happen? They'll make the filtrate, they will filtrate, it will be more hyperosmolar. So what it will do, as it is more hyperosmolar, it will retain water. So it will retain water, retain water, retain water, retain water, or the water will be here. Okay. So it will not allow water to be reabsorbed by our body. Okay. Okay, that much you understood, right? What osmotic diuretics or mannitol, what it does. What are the other osmotic diuretics that you know? Isosorbide and glycerol, correct? Okay. Then potassium sparing diuretics. Now potassium sparing diuretics, why do you need potassium sparing diuretics? Why do you need potassium sparing diuretics basically? See, basically what is happening, when sodium is being removed, even potassium is getting removed. So the body, our intention was to remove sodium so that we will not retain water. But as a side effect, we are losing potassium also. So what they do, along with these diuretics, they also give a potassium sparing diuretic, which is a weak diuretic. But what it does is, it allows the potassium to be absorbed into the body. So potassium sparing diuretic will excrete sodium and allow reabsorption of potassium into our body. But it is a weak diuretic, so it is used in adjunct with other diuretics. Okay? How many people are sleeping? What did we just now, what did we say? Potassium sparing diuretics are used along with other diuretics. It will help in reabsorbing potassium into our body, and it will help in excretion of sodium also. It is an aldosterone antagonist. Very, very good. So that is all we wanted to cover in this video. Just look at the WHO list here. The WHO list of important diuretics. You have amiloride. This is a renal epithelial sodium channel inhibitor. So amiloride has been put first. So you can see amiloride, then furosemide, then thiazide, that is the hydrochlorothiazide. Then you have mannitol, spironolactone. So all these you should know. Let's take a recap of what we have seen so far in this video. Moving on, we started off with diuretics, saw what diuretics actually do. They dilute the urine. We saw the classification of diuretics. We saw some photos of available diuretics. We saw WHO list on diuretics. That's all, right? So, we saw the sites of action also. Very good. So this is from Schanbach. They are telling the sites. Loop diuretics, ascending limb of loop of Henle, we know that. Inhibits sodium, potassium, chlorine co-transport, we know that. They are highly effective. Example, furosemide. Thiazides, they work in the early distal convoluted tubule. They inhibit the sodium chlorine symport. This also we know. Then potassium sparing diuretics. It acts on the collecting duct. It's an aldosterone antagonist. Okay. Then you have amiloride, spironolactone, etc. Mannitol works on loop of Henle and proximal convoluted tubule osmotic effect. This much we have seen. Carbonic anhydrase inhibitor, acetazolamide, it works in proximal convoluted tubule. Yay, I understood everything. I understood that whole table. Very good if you understood. Let's meet in the next videos to understand details of each of these. Okay, more details, still more we will give. Okay, bye. Bye baby, say bye.